Hello everyone, I am Dr. Sandhya, Consultant ENT Surgeon at SPARSH Hospital, Nagar. We perform here cochlear implant surgeries. What is a cochlear implant? It's an electronic device that provides a sense of sound to people who are deaf or who have a severe to profound sensorineural hearing loss. It is different when compared to the normal hearing aids. The normal hearing aids basically they amplify the sounds, whereas the cochlear implants they transform the sound signals into electrical signals, and these electrical signals are used to stimulate the auditory nerve. From this auditory nerve, the signals are transmitted to the brain to perceive it as a sound. The cochlear implant basically bypasses the transmission of the sound impulses. It bypasses the damaged cochlea or the inner hair cells. The cochlear implant is done in adults who have developed a severe to profound sensorineural hearing loss, or in children who are born deaf, or they have been diagnosed at 2 years that their hearing is very impaired following a viral illness or following meningitis. So the cochlear implant has two components, an external component and an internal component. The external component has a speech processor and a transmitter. Speech processor sits behind the ear lobule and a transmitter sits outside on the scalp, which is attached to the internal component, which is called a receiver, that is placed underneath the scalp. The receiver has a thin array of wire which has electrodes over it. This electrode array of wire is placed inside the snail-shaped coil, that is a cochlea. So what happens in this cochlear implant is the sound from the external is taken in by the mic of the speech processor. From the sound signals are then transmitted to the transmitter. From the transmitter, the signals go to the receiver. The receiver converts these sound signals into electrical signals. The electrical signals then pass along the thin wire into the cochlea and stimulate the auditory nerve directly. And these signals are then taken to the brain and perceived as sound. The procedure of cochlear implant is very simple. It is a minimal invasive, and it is a procedure where the child or the adult have to stay in the hospital for a day under general anesthesia, where a small opening is done behind the ear and to place the internal component, that is the receiver, and an electrode array is passed into the cochlea. The post-operative period, there is less morbidity and the risks involved in this surgery are very minimal. To name a few are the bleeding or the swelling at the post-operative site, or the tinnitus in some patients, or facial paralysis in some patients, and some chances of infection leading to meningitis, which is very rare. These cochlear implant patients are followed up post-operatively at 3 to 4 weeks, where the switch on is planned. Switch on is basically done by the audiologist. Post the switch on, we make sure that all the components are functioning well. And the most important thing in cochlear implant is the rehabilitation, where we expect the family and the patient to come regularly to the speech therapist for a proper therapy. At 3 to 6 months post surgery, for using all the training programs, we see the improvement in the child. The cochlear implant helps the child to gain the speech and auditory functions at earlier age. Cochlear implant is a multidisciplinary approach where we involve the audiologist for a pre-operative investigations like otoacoustic emissions, BERA, pure tone audiometry and impedance. And there is involvement of a psychologist to evaluate for the psychology of the child or the adult. Pediatrician advice is taken regarding the vaccination, the meningococcal and the pneumococcal vaccination, and a speech therapist. So all together work as a team for the proper results of the cochlear implant surgery.